Hello, my name is Dr. Ashik Hussain, and I am an assistant professor at Rashid Latif Medical College, Lahore, Pakistan. So, in my previous videos, I talked about the flexor compartment of the arm. In this particular video, I'm not using that animation model. Rather, I'm just using a plain picture or diagram, so you could have a very good insight of how compartmentalization of a limb occurs, how compartments are formed. So here in this particular diagram, we can see this green structure all around, which is surrounding the muscles, is actually deep fascia. Deep fascia is thick correct tissue layer which is devoid of fat. Deep fascia underlies the skin. This black line is representing the skin, and this yellow part between the black line and green line is a fatty tissue. So this green layer is present circumferentially, and it is called deep fascia. And deep fascia in the limbs, it surrounds the muscles in a way that it is surrounding all of the muscle just beneath the skin. So from the deeper layer of the deeper part of the this circumferential layer, we have got intermuscular septa. Here you can see in a again the green line which is coming from the circumferential layer, and it is getting attached onto the bone. This is bone, and this is septa, intermuscular septa. So intermuscular plural is intermuscular. Intermuscular septi. So here you can see that these blood vessels, neurovascular bundle, this is also present in the muscular septa, and just by look at the circumferential layer again, and these intermuscular septa which attach onto the bone. So this is how compartments are formed. Now this here you can see muscle, this group is, for example, it is now an anterior compartment, and this group of muscle is called posterior compartment. So with the help of this circumferential layer all around surrounding the limb muscles, and then intramuscular septa, and then bone. These intramuscular septi, they get attached onto the bone, and they merge with the periosteum. So this is complete curtain or complete separation between the anterior and posterior compartment. In the center is bone. On either side we have got intramuscular septi. So this is how muscles they get separated completely from each other. So now this group of muscle is called flexor compartment, for example, and now this group of muscle is called extensor compartment. So in one compartment, only those muscles come which share same nerve supply and which share same action. I mean, in this compartment, which is anterior compartment, for example, let's say it is the anterior compartment of the arm. Now these muscles are bicep brachialis and coracobrachialis, and just concentrate that these all muscles are flexors, no matter at what joint they are producing flexion, for example elbow joint or shoulder joint or whatever, but they are all flexors, they are flexing different joints, and they are all supplied by the same nerve, which is musculocutaneous nerve. So in one compartment, those muscles they come who actually share their action and their nerve supply. For example, likewise in the posterior compartment, for example, if it is posterior compartment of the arm, then it would be tricep muscle, and all the tricep heads, they are supplied by radial nerve, and they are all extensors. So again, in one compartment only those muscles will come which will share their nerve supply and which will share their action. So for example, if something goes wrong, for example during trauma or for example trauma, this bone will get fractured and there would be bleed within the compartment, and that bleed would start raising the pressure within this compartment, you know, and that bleed would definitely put pressure on this circumferential layer, which is, and this circumferential layer is tough membrane. It won't, give additional space to that bleed. Rather, it will push that blood again inside, and that will result in increased pressure within within the compartment, and leading to compartment syndrome. And as a result of compartment syndrome, we know that the blood will start accumulating in this flexor compartment. That will put pressure on the circumferential layer and intermuscular septum and bone. As a result, these muscles will push backward, and they will put further pressure on these neurovascular bundle, and as a result, the blood supply of the muscle, which has already been compromised due to bleed, will be further deteriorate and resulting in necrosis of the muscular tissue. So that muscular tissue actually can tolerate the ischemia for just 6 hours, but once that ischemia lasts longer than 6 hours, the muscular tissue would result in necrose, and due to ischemia, and that necrosis would be replaced by fibrotic tissue, and as a result, the muscles part of the muscle would undergo a ischemic permanent contracture, and that contracture is called Volkmann's ischemic contracture. So again, a quick summary: circumferential layer, intermuscular septa, bone, and then neurovascular bundles. This bleed will occur in this compartment, and that would lead to increased pressure within the compartment. That is called compartment syndrome, which would further, deteriorate the blood supply of that, muscles due to, pressure within the. As you can see, that blood vessels are also present within that compartment, and which will further deteriorate the blood supply, and as a result, necrosis would occur, and that necrosis would result finally to Volkmann's ischemic contracture. So here you can see in this diagram, you can see this blue arrow. Although the diagram is not of very good quality, not very good quality, but even then, just look at the blue arrows. These blue arrows are putting pressure on the circumferential layer, which is present here, but this circumferential layer is tough membrane that would again further push back the pressure towards the muscles, and as a result, the pressure within the compartment would raise and resulting into compartment syndrome. Again, here you can see in this diagram, you can see these are the bones, intramuscular septa. These are the blood vessels within the, what you call, between the muscles, and when bleed would occur between these muscles, that will further apply pressure on the blood vessel and further compromise the blood supply, so resulting in Volkmann's ischemic contracture. So the treatment is simple. It is just you give longitudinal, incision along the length of a limb to this circumferential layer, and that procedure is called fasciotomy. So when the this circumferential layer would be incised, and that would relieve the pressure within the intramuscular compartment, because of that blood which has been gathered or collected within the compartment, that would be liberated or released. As a result, there wouldn't be any pressure on the within the compartment, and the blood vessels which were previously compressed or squeezed, now those there wouldn't be any pressure around those blood vessels, and as a result, the muscles would survive due to blood supply again. Thank you very much.